arthroplasty. What does that mean? I mean, what is arthroplasty at all? It's just very straightforward information. And as you can see, is a plastic, right? Plastic means you fixing like facial surgery, right? You're having surgery and they plaster your surgery. That means we're reshaping the knee and create a new joint. So that's what they mean. This is all. It's a surgical procedure, right? What are they trying to do? Is to create a new joint to restore the joint back in terms of its function. Sometimes the function is destroyed from other conditions, right? So that's what we want to do, restore the function of the joint. The second one is to repair, or sometimes just replace the whole thing. Replace a damaged joint. So there's a difference between the two. The plasty is different from scope, right? So arthroplasty, basically, I'm recreating the joint. The joint is damaged. I'm fixing it into a form that may be palatable for the individual. They can use it. Well, what type of joint? But arthroplasty, right? There's a different kind. There's a total, okay, joint arthroplasty. That means the whole thing. You're replacing the whole thing of both sides. So replace both one or two sides. The whole joint has to be replaced. A joint has two sides. So if you look at a joint, I mean, if you watch football, you can see they talk about cruciate ligament. So if this is a joint, right, there's ligaments that go from one end to another. So this is one portion of the joint, this is the second portion of the joint. If you replace both, we call it total arthroplasty. So the both sides, right? There's a partial, as you can see. If you have total, then partial means only one part of the joint will be replaced, one part of the joint. There's arthroplasty, right? Arthroplasty. If you see it in the question, don't worry. Basically, one side, but half of one side. That's all. That's all you need to know. Half of one side is being replaced. This is just helping you in case you see the question, you know what to do with it. Like one side of the joint is being replaced. Common joint. So you have to know what kind of joints that they will replace. Number one is hip, right? Hip arthroplasty, total, partial. Second one is your knee, right? You've heard about it. Your knee can also be replaced. But there's other one that can be replaced, shoulder, your elbow, even your ankle can be replaced. But it depends on the kind of damage. But most of the time for your test, NCLEX just worry about the knee and the joint. That's where knee and the hip joint, that's where most of the questions will come from. Who need it? Indication, right? Who need the joint to be replaced? That's all. What do you think? What are the indication of a joint arthroplasty? Who do you think need joint to be replaced? If you know, you can put down the answer, but I'm trying to teach today. So what kind of joint need to be replaced, or what are the indications that need arthroplasty? What do you think? I will start. Okay, if you have like severe osteoarthritis, you have to know the difference, right? This is involved with large bone, large joints, right? This is the most common. This is number one, the most common reason to replace do arthroplasty. It's the most common one, and it's due to certain things, right? If you the joint, the cartilage is wear off, they may have to replace it, right? If it causes pain, they have to replace it. If it's stiffness. They may have to. And then there's a limited mobility. Yeah, these are the reason why they may have to replace that. What other conditions you think will lead to arthroplasty? What do you think? Think about it. This is osteoarthritis. If it's no osteoarthritis, then you get a rheumatoid, right? Rheumatoid arthritis can also um, will lead to replacement, especially if it's so severe, if it's due to chronic um, inflammation lead to destruction. So this is all chronic inflammation, right? Leads to like destruction of the joint. What are the reason why your joint will need to be replaced? Do you know any other joint? Avascular necrosis. That means that the blood supply to the head of your femur. That's the most common. There's a bone die and causes disruption, especially hip. You see, so there's a bone death. Basically, it dies and it doesn't work anymore due to uh, interruption of blood supply. So something happened, and there's no blood supply to the head of the joint is going to die, mostly the neck. You see avascular necrosis of the head. So this will die, then we have to replace it with another information. Well, what other reason? Fraction, right? If you have a fraction, fractures, these are indications that can cause that. So arthroplasty is what we're doing. We're trying to replace the joint. It's a surgical procedure. We're going looking at the joint itself physically, cutting through the skin and getting to the joint and fixing it. So that is the definition of arthroplasty. Okay, so that is the definition. So as the nurse, nursing care. So post-op. Before that, what do you think? Well, before you go to surgery, pre-operative management. What do you think you need to do before the patient go to surgery? The number one, you have to educate them. Education is always very important. The recovery time, what they should expect, if you can explain the procedure, what it entails, you don't have to get a consent, but you can explain to them procedure, what is going to be done, what they expect is going to happen, and post-operative care, what is going to expectation they need to know. And then you also have to teach them all these things in order to prepare for that. So these are the things pre-operatively, you got to rearrange them so that they know what is going on with the procedure. The major part of is post-operative, what you're going to do at the nurse. So number one, somebody had a surgery, knee or hip or whatever, what are you going to do? Pain management, right? Pain management. This may include a bunch of information, it be multimodal, right? You have to explain to them what kind of medication they're going to get. So sometimes they get opiates, right? They'll get NSAIDs, you know, um, they can get other regional anesthesia. What does that mean? Like a nerve block, right? So if you see that, okay, this is where we can to numb the leg so that they can get better. So expect this kind of information associated with the treatment. What other thing would you do? You've been a nurse, so you know what to do. What do you think? Post-op management. What should you worry about? That's what your test is going to ask you. What else do you worry about? What do you think? I can tell you, we got to get them out of bed. Early mobilization. You can't lay down, otherwise you get DVT, right? So you have to teach them to get out of bed and move around as much as possible. It's very, very important that we get them out of bed as needed as much as possible. Otherwise, they'll get into trouble. So we have to make sure they're getting out of bed. And this is the most important thing that will prevent DVT, deep vein thrombosis. But there's one thing you need to know in terms of mobilization. So I need to put a star there, right? What do you guys think? Patient had a hip or knee surgery and then they want to get out of bed. What do you think? This is a common NCLEX question, right? You have to know weight bearing status. So you cannot get them out of bed right away, and you have to check the order and make sure that the doctor said, hey, you can bear weight, you can step on your toe. All those things is very, very important. Then you teach them how to use walker, cane, as much as possible because they have to use this assistive device, whatever is available, crutches if they have to do that. So this is why you have to know their weight-bearing status. You can't get out of bed if you don't know what the doctor expects them to do. Remember, they cannot go home, so you don't go home, no home until walking. What does that mean? Any form, whether you're using cane, whether you're using crutches, or whether you're using walker. So you don't go home. If the question say wheelchair is a wrong answer, it's a trap. So don't pick it. Wheelchair is always wrong. So this is wrong. No, right? Wheelchair is not. They shouldn't be sitting in the wheelchair and ready to go home. They have to be walking on their leg, right? Either they're on crutches, on the walker, or using the cane. So that's a trappy answer, right? These are the things you teach them. Then what else? Physical therapy to help with restoring motion. So you may need physical therapy to help you to improve their strength. They have to also work on the muscle. It's not only that's the bone, the muscle strength to get them to where they're supposed to be as they get a new function of the joint. And of course, wound care. We want to prevent infection. So you got to take care of the wound, teach them. If you see any redness, you, the nurse, any drainage, any increased pain, yeah, you know something is not right. Right. The next one is the prevention, things you need to prevent. Prevention of complication, I call them. Number one, okay, DVT. That's right. You got to get them out of bed. And don't forget, they need anticoagulation. So whatever is ordered, you have to give them. If they give you a question, they said, oh, how to prevent DVT, get out of bed, stockings, SCDs, anticoagulation. Pick anticoagulation because anticoagulation is the most important way to prevent DVT. It's better than any other form. The anticoagulation, you have to know coumadin, you have to know heparin, and you have to know the factor 10 direct inhibitors, like the Zabans, I call them Zabans, and then the Gatrobans. So you have to know how to teach them this. You have to check on the video in terms of this is the cardiology. You can't take the test without knowing it. If you go and take the test and you don't know functions of these anticoagulation is the most common medication in this world. Almost everybody, older people are on it for other reasons. Don't go and take the NCLEX if you don't know anything about coumadin, how to cancel a patient, heparin, when is the indication to use Zabans or Gatrobans. These are like 101, NCLEX 101. You have to have a pack. You have to know which situation, what kind of teaching you give them for Zabans. They don't have to change their diet. They have to do anything. Coumadin, you still don't have to change your diet. If you watch my videos, I said, do whatever you do. You don't have to decrease your fresh leafy vegetables or vitamin K or anything like that. Stay the same thing. You don't need lab work for the Zabans. You don't need lab work. Heparin, you don't go home with heparin except the Zaparin, right? enoxaparin. This is another form of heparin. It's a sub-Q. So these are little things you have to basically, by now, you should have it packed in your books. Of course, you got to prevent pulmonary embolism. This is an airway issue. It's a B-sharp moment, right? It's the B-sharp moment. So you got to worry about it. Of course, you got to worry about fat embolism and, of course, infection. And then the big thing is joint dislocation. What do you guys think? What are the um, things you're going to tell this patient to prevent joint dislocation? What do you think? Number one, okay, don't cross your leg. Yeah. Don't cross your leg. Okay. Two, don't bend more than 90 degrees, right? Right. You got to keep them supine or low fowler with their head up. Okay, it's very, very important. Like you tell them, these are the things you tell them to do. There's certain things, this is what you can do. And then you got to put the legs apart. You use abductor away from each other, abductor wedge to keep the leg, especially the hip, from each other so that they don't come together. And these are precautions you teach them. If they're going home, in terms of certain things you can tell, I mean, they should avoid what? Low chairs. These are like classic things you should know it by now, right? It's very, very important. They have to modify their house. They have to change it so that it's consistent with this problem. Sometimes you have to turn them. So turning. There's a clue, like they can trap you, okay? You need assistance. You can't turn them, okay? Somebody to help you and turn them away from the the injured leg. You got to be away from it, okay? And then use wedge to support them when you turn them. So you can use wedge to support them. Or you can put pillows between the legs after you turn them. So this keep the two legs from coming apart. And this is very, very important. This is for um, um, hip surgery, arthroplasty. So these are the little things you're supposed to know. And then if they give you about other assistive device, they just helping you. Like if they say they have a shoe, they say if you have Velcro, don't say I don't know it. Yeah, Velcro so that they don't have to burn. They can use assistive hand devices that they can tie their shoe, put their shoe horn on, like you said, shoe horn. Yeah, these are like little things you see on the NCLEX questions. It's not a trap. It's just helping you, and then you have to apply whatever knowledge you know. If they give you a knee question, knee arthroplasty, there's few things they will teach you, right? There's few things you have to know which is a trap. It's the same thing, except you have to know that no pillow under the knee. You shouldn't do that. And you have to employ continuous, we call it CPM, continuous passive motion. If you don't know it, this is a machine. It's prescribed to promote knee movement, even though they don't move and prevent stiffness. So that's what will happen. It help with the knee movement, and you see them on it. This is specific for the knee. We don't use this for hip, but it's very good for the knee. But just know that apart from that, the same thing, don't put no pillow on the knee and then no use of continuous passive motion. The rest of the information is the same. You cannot go home without not walking. You can be in the wheelchair when you go home. You have to use stuff to go like you can walk at that other stuff. something just came to my mind. So home safety, okay, these are discharge planning stuff. I already said it, but I will put it here, discharge planning. These are things. Home safety is key. So you tell them to modify their home, right? There has to be some modification, like remove loose racks. What do you think? What other things do you think these patients should be doing at home to prevent injury? These are things you see on the select or apply. If you know the answer, you can type it. Maybe these are little things you see in the select or apply. They're trying to trap you, but they know you know it, right? Loose rags, right? The toilet seat should be elevated so that they don't burn, right? They can have grab bars, right? These are all safety in the bathroom so that they don't fall, right? They can use the walker and then a cane at home. No problem. There's nothing wrong with it. The activities to what they can do, they make sure they avoid like high impact activities, right? Like jumping. You can't jump or running. You can't do that. This will until there's a prescription from the doctor say you can do that, right? Low impact is very good, like swimming, right? Low impact cycling, but these have to be what? Prescription from the doctor. The doctor has to improve it. Last one for this one, outcome, right? If you see a question, they say, oh, we got to replace the knee every 5 years. It's wrong. These can last for like 15 to 20 years. So yeah, the prosthesis can last. So you don't have to replace it every 5 years, every 2 years. They can last for a long time. And then the doctor, unless you fail for 15, 20 years, then it can be applied. So this is knee, what? Arthroplasty. If you see this arthroscopy, it means we just put in camera and looking inside the knee. That's all. So if you take the knee, like, this is one, this or the hip, right? This is it. You take a camera and then you just look inside. If there's cartilage, you just clean it up and done. There will be tiny incisions here. The incisions are very, very tiny for the scope. And that's all. That's the difference. So plasty is not the same. It can also be the hip. So plasty is not the same as the scoping. So scope is just a minimally invasive. It's a laparoscopic procedure where you're just looking inside and trying to fix any damages to the joint. That's all. It can be applied for any other joint like the knee, the hip, the elbow. You can do the same thing. The treatment that you apply is the same thing. Management, teaching, and everything, right? It's very, very important. Just know that the incision is very tiny. They can resume activity right away. So these are not a big surgery. So that's the difference between arthroplasty. They can go home, walk, and this is an outpatient. It's an outpatient procedure. You don't need to go um, and stay in the hospital for a long time with this problem. Just 12 hours or 6 hours after the procedure, you can go home. It's very, very simple procedure. You don't need to do too much at all in terms of teaching and other things that you tell the patient. But the restriction is they can resume activities slowly as much as possible. Like I said, it's very simple procedure, outpatient. You also have to teach them signs of infection. The same thing, just swelling, redness, fever, and increasing pain. Pain management is the same. And this is the quick questions, quick information about this disease process in terms of a surgical management of a knee. So you have a joint, you have a that you can go in a plasty, and then you can replace the knee with arthro arthroplasty and then look and fix any injury with a scopy. That's all. So this is the question. A nurse is caring for a client 2 days post-hip arthroplasty. You see, post-hip arthroplasty. So that means 2 days after arthroplasty. That means we fixed the joint. Which of the following signs and symptoms should the nurse recognize as a potential complication requiring immediate intervention? Prioritization 101. That means you have to be sharp. Maybe all of this is a problem, but there have to be one that you have to pay attention to. Client complaint of pain at the surgical site. He's reporting about pain. If you do the B sharp, you know pain is if he's going to kill them, live limb eyesight. If he does, then you pick it. Presence of low-grade fever, 99.2. Is 2 days old. Shortening and internal rotation of the affected leg. Swelling at the site. So what do you think? You can put your hands down. Pain at surgical site, like I say, is no live limb eyesight problem. This is not fever. 99.2 is suspected post-op day 2 is not that bad. Swelling at the site is not the problem. Internal shortening, internal rotation, it means dislocation. So this is the most dangerous. C is the most dangerous. The leg is dislocated. And so that's a priority. And this is providing digital teaching to a client following total hip arthroplasty. Which of the following instructions should the nurse include to prevent hip dislocation? So this is the way the NCLEX, these are the things they love, you know. Hip dislocation, we talk about it. Do not sit in low chairs, right? Avoid crossing your leg at the knee. Keep your knee higher than your hip when sitting down, right? Knee higher than your hip. Use a raised toilet seat and do not bend forward to tie your shoe, right? What do you think? Tie your shoe, that's why you use the shoe horn. You're going to have a problem, right? You should not sit in a low chair. I said high chair. You should not cross your leg, right? It's not good. Right? Keep your knees higher than your hip when sitting down. It's not good. You're not supposed to do that. That will cause dislocation. The question said to prevent it, you should keep your knee below, right? You should use a raised toilet seat. So the answer is what? It's A, B, D, and E. And the last one. And this is discharging a client who underwent knee arthroscopy. Pay attention. You see, it's arthroscopy. We just look into it. Which of the following statement by the client indicate understanding of the discharge instruction? So buzzword, knee arthroscopy, we touch the patient, want to know if they understand the post-op care. I will remove the dressing and apply a new one if I see my drainage, any drainage. I will begin weight-bearing exercise tomorrow to strengthen my knee. I will keep my leg elevated and apply ice to decrease swelling. I will avoid taking any pain medication unless my pain becomes unbearable. What do you think, guys? Really wrong. It's just off. You should be taking your pain medication. When your pain is unbearable, it's too much. It's going to affect your motion, right? If you see drainage, you should call me. It's a sign of infection. You can't just apply dressing to it. You cannot bear weight until you be approved. So I will begin weight bearing exercise tomorrow to strengthen my knee. You can't do that. The doctor will tell you when you can. That's why we use the CPM to keep you in motion. So based on test taking strategy, you know C is the right answer. I will keep my leg elevated and apply ice to decrease swelling. This is the end of the class. I hope you know the difference between arthroplasty and arthroscopy and the things you need to know in terms of management. What do you tell them? Which joint, post-op management, what you're supposed to look for, how to prevent dislocation, which is key. If you need more, you can join our incoming class this Saturday, the live crash course, or just join the membership of YouTube, or you can just subscribe and get free video. Thank you, and good luck. keep up with the series, musculoskeletal. I know that's the problem most people have, so I want to kill it for you. Take care of yourself. Bye.